So everyone, I just want to start with the fact that talking about some things that we already know, we are at a crossroads in health. There is a convergence of technologies. We've talked about data, we've talked about digital technologies, we're talking about devices, but what else is converging is some of our challenges. We're hitting budgets close to 50% across Canada in terms of where health is. Outcomes are not going up. In some cases, they're actually going down. We have some big challenges that we need to face here. And the opportunity is for us to start looking at health in a very different way. To start looking at how do we enable companies and innovators in our jurisdiction to move the needle in health from a very different perspective. We look at where industry is, we're now at the AI information age, but if you look at health, we're actually still faxing, right? We're still faxing, okay? So we are behind the 8 ball on this. So now that may look negative, but from a company and an innovation perspective, that's actually great because we have a lot of opportunities to catch up to today and then move beyond, right? And that's the real opportunity here. The other thing is that this is not just an Alberta problem. This is not just a Canada problem. This is actually a global problem. And it doesn't matter whether you're in a public system or a private system or a mixed system, this challenge still exists. The challenge of being able to look at chronic disease, which is our biggest burden, and how to move the needle on that is our biggest issue. And luckily, we have some strong technology opportunities that are going to help us get there. And in those strong technology opportunities, areas like artificial intelligence and machine learning, you've all heard how strong we are in this jurisdiction. You're going to hear from Corey a little bit later on that. But there's other fields as well. Augmented and virtual reality, we actually position nationally in terms of our strengths and capabilities there. We also have emerging capabilities in blockchain and IoT. These are some of the, there's a slide missing, I'm sorry. So these are some of the enabling technologies that are going to fuel our companies going forward. And the new health economy companies, these are not companies that you and I hear of on a regular basis today. These are not the Mercks and the Pfizers and the Medtronics and the Johnsons today. Those companies are companies that we haven't heard of. These are companies working in data. These are companies working, as Mayor and Jason said, looking at social indicators of health and using social indicators of health to drive new health outcomes. These are the companies that are going to change the way we look at health today. And what's great is that we have the technology capabilities here in this jurisdiction. We can have those companies here as well to help move the needle on health. And what they're looking at is moving away from being acute, reactive, to being predictive, being preventative, driving wellness, not reacting to disease. That's a different approach. And that's an approach that we can take today because we have those capabilities. So that's the opportunity in health. What's Health City? So Health City, at its heart, is an economic development initiative. And it's around economic development for the health sector. Now, we have partners in economic development here. We have Edmonton Economic Development, we have Tech Edmonton and Startup Edmonton that provide services to our companies. So what's Health City doing? What we want to do is we want to create engines of growth for the sector. And so we need our service providers like Startup Edmonton and Tech Edmonton to be able to be fueling our companies, training our companies, educating our companies so they can get management and products to market. We need Edmonton Economic Development to continue making this jurisdiction a place to do business, an attractive place to do business. What Health City is going to be focusing on are what I call engines of growth. How do we get first-trier scenarios? Not just partnering in co-development with Alberta Health Services, and we're doing some wonderful jobs there, as you know, but how do we get the whole community involved? How do we get family physicians involved? How do we get social organizations involved? How do we get how do we tap into the data from the City of Edmonton's, I'm missing the word right now, the City of Edmonton's portal that we have there, joining that in to start making intelligent decisions around municipal investments and how that's going to impact health. So that's, that's one piece. The second piece is talent. Talent is an issue not only in Alberta, but across the nation. And I can tell you federally, there's a lot of thought and thinking going around, how do we look at training our individuals for the next economy, whether it's new health economy, new energy economy, and other sectors. We've invited Rob Henderson here, who's with BioTalent Canada. He's going to talk about what that organization is doing in partnership with a number of other organizations to help get us thinking on the right path of how do we enable and skill up our talent pool so they are contributing to the new economy. We're also looking at creative financing models. How do we look at existing financiers, angel capital, venture capital? How do we marry that up with the philanthropic organizations? How do we marry that up with traditional lenders in this space to create new vehicles of financing for our companies that de-risk these opportunities for these companies so we can finance more? So Jason talked about getting more goals. We need more shots on goal. You have to get, if you're not taking shots, we're not making goals. And to do that, we need to make these kinds of investments. The last is data, and we've talked a little bit about that. We have a lot of wonderful players here around data. We have Chris McCabe is here with talking about the real-world evidence side of things. We've got work happening at AHS. We have our innovators here from AltaML and others that are looking at saying, how do we apply new tools around data? We've got folks looking at data aggregation from Alberta Innovates. Mark Diner is here as well. What we are looking at is how do we take those data opportunities at a community level to enable that to transform health? How do we enable family physicians in the community that are already stewards of their data to look at their data in a different way, perhaps take in data from the city, take in data, other social indicators data, take in other data sets into their fold and start looking at the people that they serve in a very different way. And we're starting to do that now. We're starting to put projects together where we're combining clinicians, academics, industry together to do very interesting projects that are going to move the needle on health. But what's more important is we're plugging in our innovators. We're plugging in our companies all the way along that value chain so that they can develop these solutions for the new health economy. Those solutions can be deployed here in this jurisdiction, but they can also be exported. And that's the key point of economic development. How do we get our companies exporting internationally viable solutions around the world?